Today I'll be doing a wound culture, and I'll be needing this a pair of sterile gloves, collecting a specimen tube and swabs. So I gathered my materials and I'm going to go to the patient's room.
Come in.
Good morning, Eddie. I'll be your nurse and I'll be doing a wound culture. Are you familiar with that?
Yes.
Okay. Can I get your name and date of birth?
Lauren Russ, 1598.
Thank you. I'm going to go ahead and give the patient privacy, and I'm going to go ahead and wash my hands thoroughly. And can you tell me or rate the pain on your wound at this point in time?
I would say about a 7.
About a 7, so it's really hurting. Okay. So if this wound had wound dressing, I would go ahead and remove it and discard the dressing as per facility policy. And then I would inspect the wound if there's any swelling around it, if there's drainage, the type of drainage, and if there's any tissue breakdown at all. In this case, it looks pretty normal, like it's healing properly. I'm going to go ahead and get my sterile gloves on, get these, put them in the trash, and before then, I'm going to go ahead and wash my hands. And now I'll work on my gloves, your sterile gloves. Okay. I am going to open my specimen tube, and I'm going to put it on my sterile field. Okay, I'm also going to do the same with my swabs. Okay. And now I'm going to have to be really, really careful that I don't touch any of those sterile like swabs and tube that I put on there. So I'm going to go ahead and get my gloves on, and I'll start with my dominant hand. And now I'm going to locate these or position them in a place where they're out of my way. Okay. So I am going to grab my swab and I'm going to start cleaning the outside of the wound. Clean it real well. Put this in the bio bag, get rid of that. And then now I'm going to take my specimen tube, open it, and I am going to go in the wound and make sure I get some of that drainage on there, and then put it back in the tube. At this point in time, I will set my specimen tube down, and I will remove my gloves, wash my hands real well, and go ahead and label that and send it to lab. And then if this wound required for me to redress it, then I would redress that, and for that I'll just use normal gloves and make sure to dress that wound, and I will go ahead and document what I've done with the patient and be done. Do you have any questions about what I did?
No.
No? Okay, I'm going to go ahead and set the patient in a safe and comfortable position. Remove all my equipment, put what's in the trash goes in the trash, and what's in goes in the bio bag goes in the bio bag, and then give them the call light. If you have any questions, please call me, or if you need anything, and I'm gonna go document and take this tube to send it to the lab.